This is the story of a dog who got sick and the doctors who made her well. Lucky is a 4-year-old golden retriever. Her parents are champion dogs, and so is she. In competitions with other retrievers, she wins top prizes for speed and retrieving skills. But without the excellent doctors and powerful medical equipment at Oregon State University, Lucky might not be running and competing today. That's because Lucky got sick when she was a young dog, barely out of puppyhood. It all started one day when she was a year old. Her owner, Rod Kramer, noticed a swelling on her neck. He wasn't too worried at first. He took her to see her regular veterinarian.
I didn't really know what it was, and we actually came to the conclusion that it might be a foreign body like a grass seed or a foxtail, which sometimes work themselves into the skin.
But the swelling turned out to be cancer. That's when Rod started to get worried. He knew that some kinds of cancer can be hard to treat. Then he learned that the College of Veterinary Medicine at OSU was the best place in Oregon for treating dogs with cancer. So he brought Lucky to the small animal clinic in Corvallis. In those days, I was just getting started as a first-year veterinary student. Now, part of my job as a fourth-year student is to welcome patients like Lucky to the clinic. Lucky's veterinarian was Dr. Stuart Helfin. He's an expert in canine cancer treatment. He diagnosed a dangerous form of the disease in Lucky's neck, very close to her spine.
And it was extremely frightening to see a very, very high-grade tumor like this in such a young dog. The owner, on the other hand, was still hoping that Lucky would go and perform and get back to her what she loved to do.
The first step in treating Lucky was to get a good look inside her body so her surgeon, Dr. Bernard Segay, could see exactly where to operate. She was put into a giant machine called a CT scanner, which takes digital pictures of what's happening beneath the skin. It's like an X-ray machine, only much more advanced. Besides dogs and cats, OSU's machine has been used to scan horses, marine mammals, and even llamas and alpacas.
So the animal is placed into this big donut, and the images are created, and it is allowing us to visualize all of the structures in that particular area, and it allows us to see different slices of the body. So when we do an X-ray of the body, like the traditional radiograph, what happens is we take a three-dimensional animal and we basically create a two-dimensional image. Whereas the CT scan allows you to reconstruct the body into 3 dimensions, and that's the big advantage of the CT scan over a traditional radiograph.
The next step was performing surgery to remove all traces of the cancer.
I think Lucky is extremely well named because she is incredibly lucky and certainly had the benefit of a wonderful surgery performed by our colleague Dr. Segay.
Just 3 days after the surgery, Lucky was up and ready to run. She was so energetic that Rod had to keep her on a harness. Otherwise, she might go speeding off and tear out her sutures, the stitches doctors use to sew up the surgical incision. Another patient at OSU is a big friendly dog named Orion. Like Lucky, he's a golden retriever, but he's older than Lucky and a lot bigger. He belongs to a sister and brother named Zoe and Nate, along with their parents Jody and Ken. After a CT scan showed cancer in Orion's heart, Dr. Segay operated to remove the tumor. Now Dr. Helfand is treating Orion with special medicine designed especially for him. Orion's family is hopeful that their beloved pet will get well enough to run and play for a long time to come. Several years after her surgery, Lucky is as healthy and happy as any dog her age. She recently won the title of Master Hunter from the American Kennel Club. Now she's in training for a big competition called the Master National Hunt Test. In the world of retriever competition, it's as prestigious as the Olympic Games or the Super Bowl.
She likes to go. She doesn't like to sit still. So, you know, she is always ready to go for a walk, go for a run, chase a tennis ball, do our training. She lives to really be outside and run. So anything that's active is what Lucky likes to do.
And while she has some impairment on her mobility in her neck, she performs at a very high level. And so we think it's just a great, great story.